Cranial nerve 7 is the facial nerve, and it has sensory and motor function. This nerve exits the spinal cord at the level of the pons, and it controls the facial expression muscles. To test this, I'm going to have my patient make a happy face, a sad face, and an upset face for a few seconds. So if there were damage to this nerve, you would expect the patient not to be able to make some of these facial expressions. This can lead to a condition called Bell's palsy, which is paralysis to the facial muscles. So if someone had Bell's palsy, you would expect to see only half a smile when they smile, or you would see extreme dry eye in one eye because there's no saliva production. This is caused by infections like herpes or Lyme's disease. Cranial nerve 8 is the vestibular-cochlear nerve, and this has sensory and some motor function. This exits the spinal cord at the pons, and the vestibular branch is for balance and the cochlear branch is for hearing. To test, I'm going to have my patient close her eyes, and I'm going to rub my thumb and my middle finger together behind one ear, the other ear, and then both. Could you hear it during the duration of that test?
Yes.
If there were damage, you would expect the patient to be unable to hear during any point of that test. This can lead to imbalance or deafness, which could then lead to tinnitus or vertigo. Cranial nerve 9 is the glossopharyngeal nerve, and this is responsible for sensory and motor function. This exits the spinal cord at the medulla and controls the uvula. To test this, I'm going to have my patient say ah. You're going to look for the uvula. The uvula should elevate straight up, but if it deviates to one side, then that side is not damaged. So therefore, if there's damage, it'll deviate to the non-damaged side. This can lead to difficulty swallowing and tasting, which could also lead to glossopharyngeal neuralgia. Cranial nerve 10 is the vagus nerve, and this has motor function. This nerve exits the spinal cord at the medulla and is the only nerve that extends from the thoracic down to the abdomen. Therefore, it's the only nerve responsible for the heart, lungs, and digestive system. If this nerve is damaged, it can lead to gastroparesis, which is when food cannot empty from the stomach into the intestines. This is caused by diabetes or virus. To test this nerve, it's very complex, so it's often paired with cranial nerve testing for nerve 9. Cranial nerve 11 is the accessory nerve, and this has a motor function. This exits the spinal cord from the cervical region because the nerve is formed by the roots of C1 to C5. So this innervates the sternocleidomastoid, which elevates the shoulders. So to test, I'm going to have my patient shrug her shoulders. So if there was side damage, then that side would not shrug. The cause of this could be a blunt trauma to the neck. Cranial nerve 12 is the hypoglossal nerve, and this has motor function. This exits the spinal cord from the medulla and controls the tongue. To test this, I'm going to have my patient stick out her tongue and move it side to side. If there were damage, the tongue would move to the damaged side. This can be caused by cancer or infection.